This immunoassay can then be varied in that multiple wells can be created and a variety of different questions can be tested. So for example, in this first case, there is the antibody for a specific hormone placed in the center well, and the serum of 4 different patients placed in the surrounding wells. Precipitin bands may form between the center well and any or all of the wells of the 4 patients, and so this can lead to a variety of results. In the second example, one could test the cross-reactivity of a specific antibody. An antibody, say to human growth hormone, should definitely react to human growth hormone, form a precipitin band. But it should not react with other hormones such as insulin. This is known as cross-reactivity, and this would confound the results of the test. If one is testing for synthetic forms of growth hormone, which may not be identical to human growth hormone, then it would be of interest to know whether the antibody binds to these synthetic forms in addition to the human growth hormone. In the third example, 2 of the wells are control wells. There is a positive control, which should form a precipitin band no matter what. If it does not, this may indicate a problem with the antibody. There is a negative control that should not form a precipitin band. If it does, then it means that your antibody precipitin bands are not specific to the hormone in question, and therefore you may not be able to trust your results. In the final example, the antigen is placed in the center well, and the antibodies, say from the serum of 4 patients, are placed in the surrounding wells. This could test to see if various patients have been exposed to a specific microbe when one examines whether they are synthesizing antibodies which would bind to this microbe. So these are examples of various tests one could use using these antibody-antigen complexes in these agar plates.